Thank you, Madam Chair. It's quite evident that this hearing is strategically placed to distract from the massive $4.3 trillion spending bill that the Democrats want to hide from the American people, a bill that will further bankrupt our country, saddle us with trillions more in debt, and create federal programs that fundamentally change America into a big government socialist nation. That's because the Democrats passed their bill, H.R. 3755, that pertains to today's topic last week. We hold hearings to gather expert input on bills before they pass, not after they're passed, unless it's for messaging purposes only, and that's exactly what we're doing. But we are here attending a hearing called Examining the Urgent Need to Expand Abortion Rights and Access. Let's be clear. Abortion is neither health care nor is it a constitutional right. Life is the constitutional right. An abortion procedure ends a life. It ends the heartbeat of a precious child in the womb. And such violence is never acceptable or protected under our Constitution. Dr. Schott, if you want an opportunity to respond to that personal attack, I'll give you one for a moment.
Thank you for that opportunity, but I'm not offended. There's so much pain on both sides of this issue, and if we all come away from one point from this hearing, it's that we're not going to legislate, we're not going to find a solution that's going to make everybody happy, and we need to, our country needs to improve its behavior. We need to stop allowing rapists to run amok. We need to provide effective contraception, which, by the way, there is long-acting reversible contraception that is extraordinarily effective and has been proven, and I'm sure you would agree with me, in large-scale studies to prevent abortion by keeping women from getting pregnant. We need to prioritize relationships. Most women who seek abortion, if they tell the father of the baby about their pregnancy, I've seen this time and time again, what they're secretly hoping for is that he will say, you know what, I love you, I will marry you, the circumstances may not be good, we may not have much money, but we're going to make it work. That's what women want. And what they're getting instead is, here's $600 and Planned Parenthood's down the street.
Wow.
All of this has to change.
Wow. Thank you for being here today. You mentioned in your testimony that you have delivered over 5,000 babies in the past 29 years. Surely you've seen technology come a long way since your beginning days as an OBGYN. Could you describe briefly the impact this technology has had on improving the viability of unborn children for those born prematurely?
It's amazing. I mean, these babies are, I believe one of the witnesses earlier today was discussing her child that she could hold in her hand. Mm-hmm. But they're perfect. They're perfectly formed. They feel pain. They many times at 22 weeks, half of these babies can survive, and many of them have an intact survival. But that's not to say that it's not a lot of pain involved in that. Mm-hmm. I mean, how horrible to have a child. You don't know if they're going to live or die, mm-hmm. or maybe they have a life full of struggle. So it's amazing that we can do what we can do, but at the same time, maybe we can start looking into some of the things that cause these young babies to be born. And in many cases, it's cervical damage because abortion is so common.
Thank you. In previous questions, you expounded on the many risks associated with abortions, particularly with at-home chemical abortions. With the recent push to eliminate risk evaluation and mitigation strategy protocols, do you believe women in rural areas are at a higher risk for serious complications?
Well, certainly. The complications don't occur when the woman is given the pill in the clinic. The reason for the in-person requirements is to make sure that they desire the abortion, that they've been counseled appropriately, that they're at low risk to have a complication from the abortion. So if they think they're 8 weeks and they're really 12 weeks, there's a far higher failure rate. That's the reason for the in-person requirements. But the tail end of the abortion is that many women bleed for a week or two, pass a lot of clots, have a lot of pain, 8% bleed for more than a month. The tail end is that the complications occur long after she has left the abortion facility, which may be 5 hours from her home. And when she's in a rural area and does not have access to emergency care conveniently, those are the women that are going to suffer. If that woman really understood, I think most of them would opt for a surgical abortion in the clinic so that it's done and they don't have to worry that they're going to be one of the 5 to 8% that are going to require a surgery, often in emergent conditions, overrunning the ER in the time that we're concerned about the COVID pandemic. Using the pandemic as an excuse to tell women to go self-manage their abortions remote from the clinic in rural areas is an absolute, it just shows me that the women...
Gentlewoman's time has expired. You may tie it up or... Thank you.
Anyway, I just don't think it's good care for women. It's not showing that we value those women to put them in that dangerous situation.
Thank you. I'm
Gentleman's time has expired.